Here I would like to discuss the preventative treatments and also the treatments that happen when children or people in all ages get Bordetella pertussis or the whooping cough. So the first thing is to understand that when somebody contracts this, there's a series of phases. So there are these things called paroxysms, which is basically the coughing fit periods, and they begin about 2 weeks into diagnosis of whooping cough. So the goals of many medical professionals is to limiting the number of coughing fits, understanding the severity of the coughings, and providing assistance when necessary, and making sure that rest and recovering is a vital importance. Inpatient care is required for almost any type of whooping cough because A, it's how contagious it is, and B, because of the types of susceptibility that patients have. So hospitalization should be considered for patients at risk for severe disease and complications. That's infants younger than 3, infants aged 3 to 6, unless observed paroxysms, which is the coughing fits, are not severe. Premature young infants and infants or children with underlying pulmonary, cardiac, or neuromuscular disease. Patients with pneumonia, apneic or cyanotic spells, hypoxia, or moderate to severe dehydration should also be considered for admission. And those that require it are those that have an intractable nausea and vomiting, or have seizures or encephalopathy, or for patients with sustained hypoxemia. So basically there's just different sets of when people should be hospitalized, but for the most part, if the coughing fits are severe or very strong, then they should be hospitalized. So from the resources that I've gathered is that antimicrobial agents initiated during the coughing periods do not affect the duration and severity of the illness, but it can destroy Bordetella pertussis at a quicker rate in the respiratory tract and help prevent the spread. It's basically the super contagious part of the disease. Antibiotics may also alleviate secondary infections because it does leave, again, like we were talking about in the earlier video, with the susceptibility of the immune system now being, basically effectively attacked by Bordetella pertussis. It's very easy to get a secondary infection. From what has been kind of said is that patients of all ages should use azithromycin, and this is because at a younger age, erythromycin and clarithromycin are not recommended for infants younger than 1 month because it's been associated with increased risk of infantile hypertrophic pyloric stenosis, and it obviously carries a lot of risks for those younger. But the main number one thing for basically preventing this is immunization, and I know I've discussed it before with Streptococcus pneumonia, but it's very extremely important that people get vaccinations at a young age for acellular pertussis. It's basically, evidence is overwhelming for parents, and older siblings are the primary source of infection for younger kids. This is because it's easy to spread, obviously, and children with no immune system and no vaccination can get this very quickly. So the main cause of preventing it is to use a vaccine.